Hello, legends! Please comment and say hi and let us know that you are here. My name is Coach Bridgitte, and I am very lucky to be tasked with a Jeff Ed today to help you interpret your injury and to decide whether or not it's a good idea to carry on training or not. I have had a few clients along the way who have had little mini operations or little mini injuries, and it's been really nice to sort of be in their corner to help them figure out what the way is going forward. So I thought it would be nice to share with everybody today some ideas and some tips. But I think that what I've done is I have created a little bit of a plan of how I'm going to go through the talk today. And I can also post that once I'm done so that you can also ask a few questions. But after the chat, you can also ask me a few questions. And I think that it's really great because we are not all bionic people. We don't all go through life without having injuries. I've raced in my canoe for South Africa for 14 years, and I've been blessed to never have a major injury, but I've always had little niggles along the way. I go to physio as well. I go to the chiropractor. So you must never feel like there's something extremely wrong with you. If you have to go for a massage or see a chiro or a physio, they're all here to help you and enjoy the fact that you enjoy training, because that's always a good endorphin release, like I tell everyone, and our bodies need this. So first things first, in my plan for today is for you to identify what your injury is, and to decide if you should or shouldn't stop training. So first things first is you need to identify what area of your body is injured, and if it's referring anywhere else and what sort of pain you have. So you need to kind of pinpoint the area that's giving you a problem. Obviously, a physio and a chiropractor can decide if it's actually that area or if it's sort of another area that is causing the problem. But for me, I've kind of broken it up into 3 areas. So you need to ask yourself, is it muscular? Is it structural? Or is it a ligament or tendon? So you need to decide, like, have you actually pulled a muscle? Are you feeling it in your bicep? Are you feeling it in the muscle in your quad? Or are you actually feeling it as a pain in your bone? So sometimes then that's when people get a pain in their back, and then it's more of a structural issue. Or is it one of your ligaments or tendons? And then that's sometimes when it would be in your shoulder or your knee or your ankle, in the moving areas where your limbs are attached. So that's initially how you would sort of try and break it down. It's the same as if you're writing an exam and you get asked a question. You need to ask the question in such a way that you understand what you are dealing with, and then you know also how to decide if you can or can't train anymore. So secondly, what I've put is for you to decide on the level of the severity. So what is the level of the pain that you are going through? And I've also divided that into 3 areas. So firstly, is it acute? And then it's often something that has happened from one workout where you felt like you tweaked something. It happened recently. You're not quite sure if it's really a long-term pain or if it's actually just lasting for a short time, or if there's maybe one particular exercise that is causing that issue. So sometimes there would be one exercise, if it's your knee, that might be, say, lunges or squats, and then it would just be an acute problem, and then you would talk to your coach and you would decide, well, perhaps we should take out some exercises and replace them with something else so that you don't make it worse, but then keep monitoring it. The second option that you need to decide upon is it possibly an overuse injury? This is probably one of the trickiest ones to deal with, because it could have been something that's been happening over a longer period of time, and you haven't really realized it. And it's often not the easiest to identify or diagnose the issue. Sometimes you'll go to a specialist and they think that it's possibly a ligament or tendon and it's not muscular, or the other way around, that you think it's maybe muscular, but then it does end up being that you've actually strained something else. So this is sort of when the specialists come in, and you do go to a physio and they do a few tests, if some of you have done that, and then they try and help you identify the problem. And then obviously the third one, that it is at a chronic stage, it's been lasting for a couple months, and then this is possibly when we will start to recommend that you actually need to take complete rest. But we'll come to the bottom. I'll have some options for you going forward, so that we don't have to stop completely. So then to go back to also deciding on the severity of your injury, I've broken down those three: acute, overuse injury, and chronic, into sort of a little bit more of a description of how you can look into it. So, and also some examples. I thought I'd just give you some examples so that it's something that is more of like a real life situation that you can relate to, and that would also try and help you understand what type of injury you have and how you can compare it to. So often if you have an acute injury, which has happened in the last few days, then this is going to be possibly a fracture, a sprain, a dislocation, or a muscle strain. But obviously, if it's a fracture, that is still quite severe. So then you would definitely look to do some other exercises that are less weight bearing along the way. But that's just sort of examples that you might have gone for a run in the mountain and you might have rolled your ankle. So it is acute, but that can also be chronic depending on how bad it is. And then when it comes to an overuse injury, this is definitely something that has been niggling for a while, but you've often just pushed through, or you haven't really realized that this is happening until all of a sudden one day you get really bad pain, and then your body decides, actually, no, this has been going on for a little bit too long now. And the examples of this is often, so one of them is a swimmer's shoulder. So that would be a repetitive movement again and again, and then you have an impingement in your shoulder area. And this could be related to a rotator cuff. It could also be the ligaments between the attachment in your shoulder area. But then you also have the lower limbs, which could be runner's or jumper's knee. And this is often something that many people come or become more aware of. And these are sometimes related to lazy glute muscles. So there's often, even for myself, you have a very lazy glute, and then what happens is your knee takes a lot more strain than what you realize, especially when you're doing exercises like lunges and squats, where our bum muscles should be stronger and they should support the movement of your leg a lot more, and they don't. So then your knee takes a lot more strain. Then there's another example is Achilles tendinitis. So often how we walk and run, what you don't realize is that your foot and your ankle is probably one of the most important foundations to the rest of our body, but we don't often think about it as this. And so your Achilles is working a lot more than what you realize, not only when you're exercising, but also in everyday movement. So to get that area flared up will most definitely affect the rest of the chain of your body, all the way up to your hips and even your shoulders. So sometimes an injury on your lower limb can actually affect your hips, or and then you might only feel the pain in your hips or your lower back, but it could be from an ankle. And then another example of an overuse injury, which some people get, is shin splints. And then that's also from too much impact. So those are just a few examples. And then if you have an acute injury, then it's something that's been going on for more than 3 months. And then we most definitely are hoping that you are seeing a specialist at this stage, and not trying to work through it. So what I then decided to do is to give you a few options of do's and don'ts of while you're training if you are injured. It is a major don't to push through pain. So it's really important to identify what the level of your pain is. And if you are one of our clients, to speak to your coach and almost give them a rating from 1 out of 10 of how much pain you are having, because sometimes it's just a little bit of muscle pain or a little bit of a joint pain that you actually can just do a flow class and your body will come right. But if the severity of the pain is bordering on, I would say 7 to 10, I think, and it's consistent every day and it never goes away. Because we do have sessions that are always tougher. And when you have a tough session, you'll feel that kind of muscle pain 2 days later as well, which is called DOMS. And that's delayed onset muscle soreness, if any of you have heard about that. So if you still feel a little bit of muscle pain 2 days later after a tough session, it's not necessarily an injury, but it's also something to monitor for sure. So firstly, don't push through the pain. Please listen to your body and talk to your coach, because that's what we are here for. And secondly, don't ask the internet. Google is absolutely amazing and you can find some interesting information on there. But I definitely still think that a doctor, physio, or chiropractor are a lot more knowledgeable in seeing what really is the issue. They can identify it more rather than you Googling some options, and you might then decide that your whole body's falling apart and it's not necessarily the case. So we don't always want to ask the internet for solutions, but the great thing now is with internet technology is you can really find some amazing stretches and movements and functional things to do to help guide you to release your body. So if you can't join Kathleen's flow classes all the time and you only have time to do 3 or 4 different types of stretches or exercises, there really are some amazing people to follow who have some functional movements. I follow a few on Instagram, and I love to have a look at that as well because of my training regime. And I think that our bodies, like I said earlier, we're not all bionic people. We do get niggles along the way. And as much as it's good to push and train hard, I think it's just as good to make sure that you're stretching out the muscles that you are working. They kind of work hand in hand. And then the third point is, don't stop training completely. That's always something that you need to be careful about what level you do train at. But if you stop training completely, often what happens is the area seizes up a lot more. Sometimes they talk about a frozen shoulder, and it actually just gets tighter and tighter. So if you're not going for treatment or seeing anyone, to try and still get movement in that area in a gentle way is really recommended, as long as there's no pain. So then it goes back again to looking at what level of pain you are having, and then kind of deciding for yourself whether doing alternate exercises is an option, but less exercise. So instead of doing 5 sessions a week like you possibly were, to then break it down to moving maybe 2 to 3 times a week. And if you were doing, say, 45 minutes, now break it down to, say, 20, just so that your body is actually moving. Because I think that blood flow is definitely a good thing for your body. We do love the fact that moving releases some good endorphins, and that blood flow throughout the body is really, really good, rather than not doing anything. It also helps oxygen to move through your body a little bit better, and help you get rid of a little bit of waste in the area. So then I've also what I've done is I've broken up the area into common causes of injuries. So you can sort of decide, well, not firstly what maybe did cause the injury, because I know that sometimes you've done one particular exercise and you felt it straight away, and it was actually only caused by one particular exercise, and then it's quite easy to identify, and you won't want to repeat that same exercise again. Or you then need to look at it and decide, how were you doing the exercise? I think that often when you're watching somebody do an exercise, you always learn to get the right technique, and we can't always see ourselves doing the exercise. I know that I've spent a lot of time sometimes in my off-season training on a paddling ergo, especially when you've gone and trained with some Europeans when they can't be on the water all the time. And they have inside their gyms, they have set up indoor ergo machines. So for paddling, it's not a normal ergo that you would set up like in the gym. It's not the rowing one where you go backwards. But even so, with those, you can actually see what you're doing. But with the kayaking ergo, we would still put a mirror in front of us. And then you can actually see what your shoulders are doing. And when you're paddling, you're actually watching yourself and how you're moving. So there's absolutely no harm in doing exercises in front of a mirror. I know that obviously if you're in a public place and people think that you're just staring at yourselves, but yes, some people might be doing that. But in the same breath, I think that it's really good to see what you're doing in a mirror. And then you can actually feel which muscle groups are being incorporated. And then you might be able to look at your training session, and either if it's a picture or video, and you can decide whether you actually are doing the exercise with the correct technique. Are you doing a squat where you are putting your feet the right width apart? Are your knees in line with your feet? Are your knees caving in? Are your knees caving out? Are you arching your back when you do a squat, or are you pushing your bum backwards, so that when you driving up through your legs, you're actually squeezing your bum and using your all the limbs to actually get the weight up? Or are you actually just using your lower back when you're doing a squat, and then as soon as you start to load, or if you do a deadlift and you add some weights on the end, now all of a sudden you're using your lower back and you're not using your glute muscles, you're not using your quads, your knees are caving in, and all of a sudden the pressure is in your spinal cord and not through your muscles. So it really is important to try and watch yourself. So from Jeff Coach Bridgitte, you're not being vain if you're exercising in front of a mirror. So that takes me to talking a little bit about identifying what could cause your injury. And one of those, like I've been discussing, is then improper training or technique. So it's really important, if there's, say, 3 exercises in your training program, to not feel like you can't ask your coach how to do it and maybe what muscle groups you should be using. We haven't all grown up being athletes like I did, racing for South Africa. Some of you I know have only been starting to exercise within the last year since Jeff, which is absolutely incredible. So there's never a silly question when it comes to exercise. A lot of you have amazing careers and you've been working behind a desk and you are good at that, you're a good accountant, etc. But when it comes to exercise, you don't really know how certain things should be done. So please don't feel shy to ask questions and try and make sure that you do get the proper technique. Sometimes also, if you're using the wrong equipment or the way that you are supporting your own body is not always the best way, and that also goes to improper technique. But there's definitely ways of thinking about how to do exercises. I know that one of the common ones that come up, that mountain climbers are a killer. So I always say, when you're doing a mountain climber, make sure that they are controlled. It's not one that you need to rush and do as fast as possible. I always say you have to squeeze your lower core, squeeze your lower glutes, and drive your knees forward towards your hands. And keep it controlled. So that's one that I always find as a question that comes up, that mountain climbers are tough. But it is, because for one, you're holding up your own body. You are also trying to be in this horizontal plank position. And as soon as your bum drops like this, then you actually can't activate your lower core and you can't activate your lower glute muscles either. So it's really important to kind of make this mental switch in your head that you know which muscle groups you should be activating, and that you shouldn't just be using your limbs or your shoulders to like hold yourself up, and your bum should definitely not be dropped so that your back is arched. It's always like you talk about a little bit of a tabletop, that you're trying to have your back in a tabletop position. And then again, if you do this next to a mirror, you can actually see what your body does. So you can glance to the side and be, oh, cool. Actually, I remember what Coach Bridgitte said. I had to keep my back straight. And I think that looks like a little bit of a table that I could serve a cup of tea on. So that's also something to think about. But then you could also, what you might not be aware of, is have some sort of anatomic or biomechanical issue in your body. Have you broken a bone in your leg? Have you broken a collarbone? What does your spinal cord look like? Do you have a bit of scoliosis, which means that you have this little bit of a kink in your spine? And then the recommendation is that you should do exercise. But the issue that you will have with that is that you will always have little niggles along the way, even though it is good to exercise. But then what will happen is your pelvis will always be slightly out, and you might get some problems with your hips. So then it would just be to look at what intensity you are able to train at if you do have this anatomical or biomechanical issue. And another thing that often comes up again is that your SI joint, if you go to physio, they often talk about that, and you might not know what an SI joint is, but that is also in the back of your pelvis. And then our pelvis sits like this. And then what happens is the one tilts the one way. And so all the muscles on that leg work in a different way to what this one does because of this slight tilt. And then you go to a physio or chiro, and then they tilt it back. And it doesn't always last that long because the pattern of your muscles has developed in such a different way. So it's a consistent challenge that does happen, but it's something that I've also had along the way. And like I said, I've never had a major injury that I've been out for a couple months. It's just about going for treatments, and doing rehab does not mean there's anything wrong with you. It just means that you have a little bit of a niggle that needs some constant love and attention, or some extra hard work, some extra 10 minutes every other day, just to make some smaller muscle groups stronger. So my last point is basically almost getting to if you should or shouldn't train during an injury, and possibly how to stay fit if you do have one, because we all know how excited everyone gets when they're starting the one-on-one program. And the first week, you most definitely feel the stiffness because we are challenging you to a certain level, but we're also not challenging you too much. But it's completely different muscle groups to what you have been using. And this muscle stiffness is absolutely normal. So in the beginning, you working really, really hard, then you're unsure what is happening to your body because now you have this lactic acid. And like I said, often the second day afterwards, you're feeling just as bad, but then that's when the session is a little bit shorter. So you have all these challenges in the first couple of weeks, and sometimes you might not be aware that actually you have had a small little injury lurking, but then all by exercising and bringing in a new training program, it just has made it flare. So doesn't mean that you now need to stop completely. It means that there is always an alternative to do along the way that has got less impactful exercises. And then we kind of take it from there and decide when you're ready to start challenging your body a little bit more. So something that is less impactful, which you can do, especially if you have a bit of a lower limb injury, is pool running. I know a lot of athletes who have had small injuries along the way, and they've had a season where they can't actually run lots. An example is like what I've just competed in is the doozy, where it's a paddling race, but it's a bit of an adventure and running as well. And they've injured an ankle, and they've spent about a month and a half running in the pool with either pool noodle wrapped around your body or a life jacket on. And you kind of just adapt your training to doing intervals in the pool. You can't just do a bit of mind numbing and like run on the spot for half an hour, but you can most definitely break up your running session into, say, 20 minutes to half an hour of 2 minutes on, 2 minutes easy, 2 minutes pushing it, or 30 seconds harder. So that's definitely an option, and it's not impactful, but at least then you're actually getting your legs moving, which I think is really, really important. And even though it might not feel like you're sweating or you're working really hard because you're in your swimming pool, you most definitely are activating your muscles, and they will be happy to be working like this. Then the second one, which is obviously not available to everyone, is the Alter G anti-gravity running. I've done that before as well, and you're standing on a treadmill, and then you have a pocket around your waist, and then they pump up the air, and then you can run on the treadmill, but obviously the impact on your limbs is it's almost like you're not really running, so you don't feel the strain on your ankles or knees at all. But like I said, this is not really available to everyone, but if it is, it definitely is an option to try and still keep moving. A third one, if you don't have a chronic injury between your ankle to your hips, is to just do some stair walking. Obviously, if it's just acute, you would need to identify which area is a problem, but especially if you have an upper body injury, and sometimes running is going to cause a little bit of trouble in your shoulder as well, then walking upstairs is a great one. I don't know how many of you, when you were younger, tried to race upstairs with your siblings or friends, and you would know how out of breath you get from running or even just walking upstairs. I went hiking this last weekend, and it did feel like stairs. It was absolutely crazy how your heart rate spikes doing something like that. So that is an option where you just need to do a couple stair walks, nothing fast, controlling it, and this is at least going to elevate your heart rate, and in your brain you'll feel like you actually are still burning calories, and in your body, because you definitely will be, but not putting any strain on any parts of your body. And then if you can, go for walks or little runs, if those are options to change from your regular gym or HIIT sessions, then these are also good options to do. Walking between 30 to 60 minutes is absolutely amazing for your body. We also don't realize how your heart rate is not going to get spiked, but you are still going into that zone of feeling like you are sweating a little bit. And if any of you have ever recorded a walk, you're still getting that calorie burn in, which is still something that in your body and brain, you're still feeling like then you're actually doing something, which is, it's really, really good, and not doing nothing. But we also need time to get out and get some fresh air. Then another option is to replace one love with another. So if you are always running, then that's when you will probably replace running sessions with swimming, for example. But if you have something wrong with your knee, you could put a pull buoy between your legs, and you can do that as an alternative and rather do some swimming and use your upper body. So there's always ways to alternate training, or less impactful, you could sit on a stationary bike and do a little bit of a cycling session rather than running, but you're still getting your legs to work. But one which you have obviously signed up for is a HIIT session. We would then change it to a lit session, because we want you to avoid that 100%. But it doesn't mean that you can't go back to that afterwards. And then an important thing along the way is to monitor your pain. So we can give you alternate exercises to do, but it's also really important to sort of still zone in on the area which is giving you the problem, deciding what level of pain it was, and if you do alternative exercises, is the pain there still? Is it less? Or are you still getting the same sort of pain that you had even if you change the exercises? Then you need to reset again, and decide if you actually do need maybe only 2 days of trying to be a little bit active, or only 3 rather than say the 5 or 6 that you were doing before. So it's really important to still be absolutely aware of what is happening in your body. And then obviously the most important is to stop an injury before it happens. So that takes me back to being aware of your own body, identifying the pain, rating it from a scale of 1 to 10, so that you can decide in your own self this is actually just a bit of muscular pain from training because I haven't been doing this sort of exercise ever in my life, and it's going to recover. Once the lactate moves on, your body's going to get stronger and your muscles are going to start to work. Or is it actually leading into an injury, and it's something that the pain level is actually a bit high, and then it's not a good idea to keep going and working and doing the same exercises again and again, because then you will for sure get a little bit of an injury, and then we'll have to stop you from doing these amazing sessions with all of our coaches for a while, or we will then need to give you an option of only doing flow or Pilates for a couple of weeks, which is also okay, and develop different muscle groups along the way. So for me, that's in a nutshell of how I would help you identify what sort of injury or niggle you have, and also in a nutshell recommend that you don't stop 100%, but that you get guidance from a professional, and then you also become a lot more aware of your own body. And so I am here available for questions if anyone has any questions. I know that there are many other coaches that have also studied a degree in biokinetics. I did human movement science at Tux, so we are very aware of certain injuries and ready to answer any questions and try and guide you through and understand if you have just a niggle or muscle pain, or if there's anything a little bit more serious, to send you to a physio and then monitor it from there. So yeah, I think that is my Jeff Ed for today. I would love it if you have any questions, but if you also have questions later on, you can also pop any comments or questions in this feed, or even a direct message me, and I will be able to get through to you and give you a little bit of advice along the way, and maybe work with you and your coach along with some of the other coaches from Jeff to try and see how we can diagnose your issue and decide if it's just acute, or if it's overuse injury, or if it's actually leading into something that could be a bit of a chronic injury, and then it might be a little bit more serious. So I hope that you've enjoyed the Jeff Ed today. If I don't see any questions coming up on the side, then I might call it a day, and I will wait for your questions that will come through later on and answer them, or any direct messages. You are welcome to send those to me as well. So thank you so much for joining us. I am looking forward to chatting to some of you along the course of the day or the week once you have watched the Jeff Ed. I hope you have a super week. It's a short week after the Easter weekend, and I hope you've all had a lovely time with your family and friends. But that's me, Jeff Coach Bridgitte, signing out. Have a lovely Tuesday.